Hey, this is Pharmacist Curtis Alexander. In this video, I'm going to be going over Glipizide, which is a diabetes medication, and just kind of giving you an overview from the dosing to what it's used for, some of those other things, side effects, warnings, so on and so forth. At the end, I'll kind of give you my overall view of it. So I want to hop right into it. As we kind of talked about, it's diabetes medication, but it can only be used in type 2 diabetes, which means you still have a functioning pancreas. What it does in your body, so there's a few things going on. Number one, it's in a class of drugs called the sulfonylurea. And what they do, they essentially go to your pancreas and they stimulate the beta cells in the pancreas to release insulin. What also happens is we see a decrease in the amount of glucose that's released from your liver. And finally, we can see some increased insulin sensitivity in the periphery of your body, the outside of your body. So that's essentially what Glipizide is doing. Now, as far as dosing, you're going to see different dosing recommendations. I always recommend with Glipizide start out with the lowest dose possible, which is 2.5 milligram. In most cases, that's a safe dose to start with. So 2.5. Some people will start at 5 milligrams a day, and this is for the immediate release formulation. And you want to take that about a half hour before meals with the immediate release. You can increase it by 2.5 to 5 milligrams every 4 weeks. It really depends on how you're doing. I always like to see people stay at the lowest possible effective dose, and I'll get into why here in a second. Max dose is 20 milligrams a day, most people's standards. And then there's also an ER formulation. So when you get up to say 10 milligrams a total daily dose of the IR, you may be doing 5 milligrams morning, 5 milligrams evening. With the ER formulation, it's always once a day, 2.5 to 5 milligrams daily. You take it with the first meal to start out, increase slowly. The ER formulation is generally a good one if you're somebody who's diabetic and your sugars aren't completely out of control. If they're fairly close to goal, ER would be a decent starting point. If you wanted to switch, either way, you just take your total daily dose. So, if you're taking 10 milligrams daily, so 5 milligrams twice a day of the IR, you could just go to 10 milligrams once a day. So that's how you switch. Now let's get into the warnings and side effects, because there's a few of them with Glipizide. First and foremost, and this is controversial, sulfa allergy. So you'll have people come in and go, okay, Glipizide's a sulfonylurea. I have a sulfa allergy. I can't take it, right? And the general consensus is that we need to be very cautious with those folks. But what we find is if somebody had an allergy to, say, a sulfa antibiotic, the cross-reactivity, the chances of reacting to Glipizide, which is not an antibiotic, is fairly low. So there's some doctors that don't worry about it, some pharmacists don't worry about it, others do. I tend to be more on the cautious side. If you have a sulfa allergy, I would be very, very careful, but the evidence is kind of conflicting. So I just wanted to throw that out there. Obviously, the main side effect we're worried about is blood sugars going too low. Remember, we're releasing more insulin, we can see sugars go low. It doesn't happen frequently. We see this in around 3% of folks, but something you want to be concerned about. The people who are at the biggest risk, you have to be careful how much food you're eating. If you're in an extreme deficit, if you're trying to diet and crank and weigh back on the calories, that can put you at higher risk. Prolonged exercise, if you're a runner, a marathoner, something to be careful of. Drinking alcohol is a risk factor. So is your age. We see the hypoglycemia, the low blood sugars, more in the elderly population. Certain beta blockers can increase the risk of this hypoglycemia. And that kind of ties into sympathomimetic agents. Basically, these are medications that cause your sympathetic nervous system to kick in. So hypoglycemia is the main side effect we're worried about. Now, what are some other warnings and side effects? A lot of people nowadays have had bariatric surgery, stomach stapling, those sorts of things. We have to be really careful because it changes the absorption pattern, and we can see, again, it ties back into the hypoglycemia, but it really should be a risk factor for hypoglycemia. You can take it during pregnancy, but most recommendations state stop it 2 weeks prior, because we can see in moms who take Glipizide right up to delivery, we can see hypoglycemia in the infant after the infant is born. So it's something most of the time they're going to have you stop a couple weeks prior to giving birth. Cardiovascular disease, another controversial one. Some studies show that you can see an increase in cardiovascular mortality versus just a diet and insulin. The problem with this is there's conflicting evidence. So that's something obviously you're going to have to talk to your doctor about. I just put it out there to be on the safe side and to let you know. Now, as far as kind of some of the more, rather than warnings, but some of the side effects we see, diarrhea is not uncommon, 1 to 5%. Nervousness and tremor around 4%. Dizziness, we can see 2 to 7%. Funnily enough, I don't even know if that's a word, it is here. Constipation, 3%. You can also see diarrhea. So people are always like, well, why can I see 2 different things? We don't know. I mean, that's one of the things about medications. They think it's always scientific, and we don't always have the explanations, but you can see either or. So my overall thoughts as a pharmacist on Glipizide: not usually the first line therapy. Most people are going to start with metformin, which I think I did a video on metformin. I'll post it in the description. But for folks who've tried and failed metformin or not quite getting the results, Glipizide is maybe a next best step. We have a lot of different dosages. We can kind of get the right dose for different patients. There's some risks though. I mean, most of the time we can manage the low blood sugars. Most of the time, if we start low enough, go slow enough, we can manage the blood sugars. The biggest thing is, as a diabetic, I'm just going to be really frank here, most diabetic patients who I see getting medications do not have their diet on point. They're either following these wacky extreme diets, or they're just not eating very healthy, meaning a lot of processed garbage. And so, yeah, Glipizide, these medications can help, but only as much as your diet is dialed in and your lifestyle is dialed in. So anyway, if you've taken Glipizide, if you know somebody who's taken Glipizide, what were the results? Did it help? Did you experience side effects? Post it in the comments. It's helpful for me. It's helpful for other people who watch the video. Okay, so I hope this video was helpful, and until the next one, I will see you. Thanks.